This is Dr. Weiner, and I'm going to demonstrate how I treat the aging jaw with my reJAWvenation technique. So as the jaw ages, you lose bone in the height of the mandible as well as in the angle of the mandible, the gonial angle. So you need to replace that with filler. What I do is I choose the lowest part of the jowl as my new starting point, and I inject beneath the jawline and in the angle of the mandible. And I do that for the other side as well. Bellafill is a great filler because it's long-lasting and has a very high G prime. I also inject into the prejowl sulcus as well as into the chin. I'm now going to demonstrate how I do the triNECKta procedure. Initially, I inject with hyperdilute Radiesse, which is a 4:1 dilution, into the subcutaneous plane superficial to the platysma. I do several insertion sites and I use a 22 gauge cannula for this. This causes collagen stimulation as well as tightening. The neck, just like the face, loses volume, and this is a necessary component to completely rejuvenate the neck. I then switch over to the Genius, which is RF microneedling device. It is used to cause tissue tightening. It has insulated needles, which leads to coagulation in the dermis but spares the epidermis. This leads to new collagen, elastin, and hyaluronic acid formation. What separates the Genius from the other RF microneedling devices is that it has impedance feedback, which means it is able to sense the resistance in the tissues and deliver the energy more safely and efficiently.